Hello and welcome. I'm so glad that you're joining us today. My name is Captain Christian Rathke. I'm the Director of Office of Health Services. And this month, May, is Mental Health Awareness Month. Um, I'm, uh, uh, we sent out a document earlier this month to really just showcase some of the things and some of the services that the Office of Behavioral Health and Wellness offers, and to really introduce you to some of our behavioral health officers here in the agency within NOAA. Today, I'm going to have a conversation with those three officers, and we're so fortunate to have these three officers within our agency. And so we're going to learn a little bit more about who they are, what kind of services they offer, and also maybe some of their thoughts of really how to handle the current pandemic we're in, and maybe how to handle some of the complications you might have from a mental health perspective after the pandemic as well. So with that, let's start with introductions and get to know our panel here today. Let's start with you. Commander KJ Green is the Mental Health and Wellness, Behavioral Health and Wellness Officer with OMAO. Why don't you take a minute and introduce yourself? Commander Green.
Thank you, Captain Rathke. As you just mentioned, my name is Commander KJ Green. Please just call me KJ if you're comfortable with that at home. I'm the Director of Behavioral Health and Wellness and the Behavioral Health and Wellness Officer in OMAO. I'm a licensed clinical social worker by background, earned an undergraduate degree from Purdue University, a master's in clinical social work from Indiana University, and am currently completing a doctorate in behavioral health from Arizona State University. I'm originally from Indiana. If you know anybody from Indiana, you know that people who are from there tend to strongly identify as having been from there. So I'm a Hoosier, and I'll probably never live in Indiana again, but I'll probably always call it home. I'm married to a beautiful wife who is out of my league, so I feel fortunate daily about that. And we have a young son who was born in April of 2020, right in the middle of the pandemic year. So that's a brief introduction about myself, and I'll hand it back over to you, Captain Rathke.
Yeah, thank you for that. All right, let's go to our next member of our panel, Lieutenant Commander Andrea Battle. Take a moment and introduce yourself to everyone.
Thanks, sir. Hi, my name is Andrea Gonzalez Battle. I'm a clinical psychologist by training. I have my PhD from University of Illinois at Urbana-Champaign and my undergrad in psychology from Duke University. I've worked in a number of mental health settings, hospital, military, and academic settings, including teaching counseling for master's students, which I really enjoyed. I'm from South Florida originally. I've been living in DC metro area for about 11 years or so. In my free time, which is not much these days, I really love salsa dancing, reading. I love to write stories. And I am married to my favorite salsa dancer that I know. And we have two little kids, girls age 5 and 3. It's a little about me.
Great, thanks. I appreciate that. And last but not least, Lieutenant Commander Valerie Gardner. Tell us a little bit about yourself, please.
Hi, call me Valerie, like Andrea and KJ. I joined National Weather Service last September. I'm a licensed clinical social worker, also a master's addiction counselor, and I have certifications in integrative health and nutrition. Currently working on a Doctor of Science degree in integrative health. That's a passion of mine. I'm married to an engineer. Can you imagine the fun of an engineer and a social worker being in the same household? We've been married for 24 years. We have 2 boys, Jordan, who's 20, and Justin, who's 17. We're originally from North Carolina, and we love most outdoor activities. Thank you.
Great, thanks. Well, that's a little bit about our three panelists. So fortunate to have everyone together, and for you to be able to get to know who these really incredible individuals are, and resource that we have within the agency. So, kind of speaking to that a little bit, as I go around and people ask about what behavioral health is. It seems like this term that it's hard for people to get their head wrapped around. So I'm going to just ask the panel here right out of the gate, what is behavioral health exactly?
I'll take a first swing at it if Andrea and Valerie are okay with it, and feel free to jump in and correct me where you think I might misstep. The term behavioral health, in my view, is if you talked with 10 behavioral health officers or 10 behavioral health providers, you might get 10 different definitions that all kind of overlap on some central stuff. Behavioral health is kind of a newer term, if you will. It used to be more about mental health and substance use. They existed kind of in silos and were treated very differently. Many people now recognize that behavioral health, or excuse me, that mental health and substance use are belong within the same silo or within the same industry, if you will. And so then they created the term behavioral health to be an umbrella term for both mental health and substance use. After that, I think clinicians started to realize that we're just focusing on clinical stuff like mental health and substance use, but what we could also look at subclinical stuff like stress. So then stress got pulled into behavioral health. And then we started also looking more at preventative stuff, like things that we could do to stay healthy instead of just responding to stress, responding to mental health conditions or substance use conditions. We can actually be more proactive and engage in what's called health behaviors. So mental health, substance use, stress, health behaviors, all of those things kind of got encapsulated into the term that we now use, which is behavioral health. At least that's my perspective, but Valerie and Andrea may have come at this from different angles. So I'm curious if they have additions or detractions from what I offered there.
I
Now-
like what you said, KJ. I'm sorry, Valerie.
You
I
go
like
ahead.
what you said, KJ. I think I would also add a little bit. I think it's helpful to think about mental health as kind of a state of well-being, how you are feeling, how you are doing. And behavioral health kind of adds in the component of the behaviors that you engage in that either, increase your state of well-being or detract from it.
And I was going to say, echo what Andrea and KJ. KJ, I like your description of behavioral health as a all inclusive, a comprehensive term for how we take care of ourselves, and we can't exclude mental health from every other aspect of our lives and our anatomy. So I love your description.
Thank you.
Great. Well, I definitely feel a lot more knowledgeable. Were you going to add something, KJ?
No.
Okay, well, perfect. So that answers the question of what behavioral health is. Let's switch gears a little bit then and bring things kind of current. So last 14, 15 months, we've been going through this pandemic. It's impacted all of our lives, throughout our whole entire NOAA family in so many different ways. And in our extended family, loved ones and people we care about in our lives. And so I'm really curious from this expert panel that we have, what, in your perspective, what are some of the common ways the pandemic is affecting us all, that you see the pandemic affecting us?
One common theme, I think, Captain Rafke, is just, everyone's been impacted by the social isolation that has been brought on by COVID. I talk about anatomy again. We're designed to have close contact and connections with others, and we've lost that through the pandemic, and that has left a void for many. So I would say loneliness is one of those common denominators that is at the top of the list of biggest impact. Loneliness and isolation, biggest impactor of the COVID pandemic.
I agree with Valerie. And I think I would add too that there's a big increase in a sense of being overburdened or overwhelmed during this pandemic, since we're all kind of juggling. Everyone's situation is different and what our responsibilities are different. However, we all are adding more and more to our plates. And there's such a lack of distinction between our home lives, our home lives, our work lives. All of the different things that we're trying to balance are really much more blurred together than they have been before. So it's kind of a sense of trying to make your own boundaries and your own healthy limits to each part of your life that helps you be productive. So I think there's a higher sense of feeling burnt out and overwhelmed than there has before, too.
Third thing that occurs to me here is grief. Not just grief in the way that we usually think of it, which is grief for loss of life or grief for people who have experienced hardships because they were personally impacted by the pandemic, but also grief for the life that we thought we were going to live in 2020 that we didn't get to live. So like in 2019, we kind of projected a life that we were going to have in 2020. So we were invested in a life that we thought we were going to live. And then that year was kind of taken from us. I mean, it was shifted, but our expectations had to change. And so I think some people are experiencing a sense of grief because they're not or didn't get to live the life that they had planned to live in 2020. And that's continuing on now. So it'll be interesting to see how that resolves over time. But I feel like grief is also a component of something that we've experienced since the pandemic has visited us.
I'd like to add too that during this past year, there's also been a significant increase in behavioral health diagnoses and behavioral health concerns, which is important for us to note during this month and during this video that, the number of those who've been experiencing anxiety symptoms or depression symptoms or a sense of trauma or even thoughts of suicide or PTSD, that's have increased significantly during this past year compared to how it was the year before.
Yeah, no, and I think we can all relate to the things that you're saying. Valerie, I heard you say loneliness. Andrea, the word that stood out to me that you had said was burnout, and KJ, I heard you say grief. As just a human being, as we all are, from your professional perspective, what are some practical tools to help handle some of these things? I'm really, help, right? Is what a lot of people say, or felt that way at different times throughout the pandemic. What would you offer up as practical tools to help us out?
So I think we're going to share some of those tools, but I just want to say, I appreciate the team being a part of the team, and I think just us having this conversation is very helpful in acknowledging Mental Health Month. But COVID has brought attention that mental health and mental illness is a real condition, and no one's immune to being impacted. We have environmental stressors that can throw us off our normal paths. And so we're highlighting normal reactions and emotions that you can experience as a result of things happening outside of your control that, as KJ highlighted, that we didn't plan for, we weren't expecting, and you couldn't really plan through it. You had to live through it. So as we highlight healthy ways to manage and cope, I think we need to highlight just having conversations, being willing to just talk about mental health and the impact of COVID and in burnout and any other environmental stressors that we encounter as we live day to day.
Well said. I absolutely agree with that. And adding to that, when we have conversations, hopefully part of that is that we're getting informed and staying informed. And I feel like being informed is a cornerstone to dealing with this well. But it seems like we're not that great at figuring out the bumpers for what it means to stay informed. Sometimes we're grabbing information from sources that don't give us good information sometimes. Or I think of taking in information like the same as a nutritious diet. Like when you're eating food, you want to take in information that's high in nutrition. You want to avoid information that's low in nutrition or junk information or junk food. And then you also want to practice portion control. So getting information that's from good sources, like whether that's the World Health Organization or the CDC, or my personal favorite for getting information about the pandemic is from Captain Rathke. So I recommend sources that are nutritious, but also staying away from sources that might give you information that isn't necessarily meant to inform you. It's got another incentive, like to get you to stay tuned through the next commercial break, or the incentive is to get you to like or click or retweet. So those are sources of information that you can take in, but I'd recommend doing it sparingly because it might not be the most nutritious information out there. And regardless of what information you're pulling in, it's still wise to practice portion control, just like you do when you're eating food. I don't care how nutritious the food is. At some point, you have to push your chair away from the table. You can't just keep eating food no matter how good it is. Same way with nutrition, or same way with information, excuse me. Once you're taking in more information than you can use, then the information is just there for you to worry about. And that's when you start to turn a corner from a behavioral health perspective. If you're not using the information to inform the way you engage with the world, then you're just using it to worry about the world. And so it's important to figure out how do you get enough information to be useful, but then push your chair away from the table and stop taking in some information. Get away from the news, get away from your screens, and live your life instead of overindulging in information. I don't know who else has something to add there, but that's something that immediately comes to mind. Unless we want to talk about like the performance triad, or I don't know. I'm getting a nod, maybe.
Yeah, let's talk about some health behaviors that could be helpful tips for
Sure.
our viewers to know about.
Yeah, when I was, and I'm going to mention the performance triad, but then share them out with Valerie and Andrea because they certainly know more about certain components of that than I do. But when I was detailed to the Army, they were big on talking about the performance triad. It was 3 health behaviors. They were fitness or physical activity or exercise, nutrition and diet, and sleep and rest or recovery. I can speak a little bit about fitness or physical activity and exercise. According to the National Institutes of Health, I've read this a million times and have presented on it quite a few times, that the recommended allowance, if you will, or the recommended guidance for physical activity is 30 minutes of moderate intensity physical activity 5 days a week. Basically what they're looking at is 150 or whatever that comes out to minutes a week. And so I just think of it as a half an hour, 5 days a week. And moderate intensity is basically getting your heart rate up high enough that you can still hold a conversation, but you can't sing a song. You kind of want your heart rate up that high. And if you do that for 30 minutes a day, 5 days a week, that's kind of where you get the biggest bang for your buck. I mean, of course, if you're more intense and you do it for longer, you continue to get benefits, but the benefits have a diminishing return. So where you get your maximum return on investment of time and energy is moderate intensity, 30 minutes a day, 5 days a week, brisk walking, light jogging, jumping jacks, whatever that looks like for you, riding a bicycle, using a rowing machine, that sort of thing. As far as I know Valerie's huge on nutrition. She knows a million things about nutrition that I don't. I'm happy to kick nutrition to Valerie.
Thanks, KJ. I appreciate that. 30 minutes a day. I love that formula. I always tell people we get a natural dose or release of dopamine, which is the hormone that really gives us energy and helps us feel good when we exercise. So I'm not crazy about exercise, but I love how it makes me feel after I do it. So I just schedule it in my day. And nutrition, KJ, when talking about separating from non-nutritional sources, he kind of highlighted some important factors. I think during COVID, and Andrea highlighted that everything has collided. So we've probably been less mindful about how we're eating, when we're eating, are we eating in balance? So I always encourage, just think of your plate, divide it in half and make sure every food group is on that plate. If you're eating processed foods or extreme, like a lot of one source, you're not getting balanced nutrition. So you want to make sure you have complex carbs. It feeds our brain. It gives us energy for that 30 minutes of exercise a day. You want to make sure you have a nice, healthy protein, and that can come from animal sources and plant sources if you're vegan or a vegetarian, and then your fruits and vegetables. So when you look at your plate, just make sure it's balanced and you're not eating from or skipping meals or eating from one particular source, or like KJ said, overeating or overindulging. Those are the things that can make us not feel so good and not give us the energy that we need to kind of manage and juggle all the things that are being thrown at us. And so that's my 2 cents on nutrition. I think I want to hear what Andrea has to say
Yeah.
about rest.
So I'm passionate about rest and sleeping. So let me talk about these for a little while.
Me too, by the way.
Very
Love
important,
the
very
sleep.
enjoyable. Just like KJ mentioned about the guidelines, CDC guidelines for exercise, it's also recommended regarding rest and sleep that you try to sleep between 6 and 8 hours on average, 7 hours a night, whenever possible. That's important for a couple reasons. One, a lack of sleep can really start to have an effect on your mental and physical health. So, um, being able to give your body time every night to restore itself physically and mentally is this huge buffer against feeling overwhelmed, against having more chronic conditions worsen, and helping you kind of maintain level function that you're used to and that you need to get through your day. So the sleeping part itself at night is important. In addition, thinking about resting and kind of just being having moments of rest during the day. So that could even be just a few minutes. So say you have a meaningful day, like meetingful day, as many of us do, and you're running from one meeting to the next. Maybe you have like 15 minutes between meeting A and meeting B. Maybe at that time you just look away from your screen for a few minutes, close your eyes, and just do some deep breathing or some mindfulness. Just basically taking a moment to just be present wherever you are in the here and now, not thinking about um, what just happened before, what you have to do the next in 10 minutes, but really letting yourself rest even for a short period of time. It really has a cumulative effect when you allow yourself moments, little bits of time, 5 minutes even during your day, when you wake up in the morning, at lunchtime, in the evening, whatever you can kind of make work in your schedule and with your responsibilities. Having those little brief moments of mindfulness or of calm or of breathing, just being present with yourself, can really have a strong effect on allowing you to feel more rested, even when your day is very busy and not restful from the outside. The way that you are able to kind of make use of your downtime and giving yourself some restorative moments can really help you cope with difficult situations and difficult times like this one.
That's super helpful. So, just to throw an additional question here. So, I get it. I need to exercise more, KJ. I get that, and Valerie, I get that. That I need to eat healthy. But sleep might be a little bit for me. Like as I said at the beginning, I like to sleep, Andrea. Right, just like you. Yeah, that's if there's a topic I like to sleep. But if I'm really stressed, what do I do if I just am not able to sleep? Do you have any recommendations if I'm struggling with how to sleep?
Absolutely. So first, I would say, if you're interested in talking about that, please feel free to reach out to one of us. We're happy to talk to you about any sleep hygiene tips and techniques you can utilize. So I mentioned the term sleep hygiene. That's a common word that mental health providers use in terms of helping their clients kind of sleep better. So you may notice that you're having trouble falling asleep or having trouble staying asleep once you are asleep. Sleep hygiene tips, there's many of them, but some of the most common ones are things like excuse me, having a routine at the end of your day. So at the end of your day, maybe the last half an hour, whatever you can, how you can work it in your life, have a routine where maybe you take a bath at the end of the night or take a shower, or because that's helpful because although your body heats up temporarily, about 20 minutes after your bath or your shower, your body temperature is actually lower than normal, which is helpful for sleeping. Maybe having a moment to just kind of do some reflection on your day or some thoughts about your day, your how you're feeling in general. So just having a routine, or having maybe you read to your kids or sing a song or something you might do every night to kind of have a routine that kind of cues your mind, this is the time for me to start resting and getting ready to sleep. You can also try to not do anything in your bedroom except for sleep and rest in there. If you're working at home, which many of us are, try to work somewhere else in the house and then come back to the room when you're ready to rest. There's a whole number of tips, more than I could say in this video, but I would say if you can look up sleep hygiene, or if you want to talk more about how to actually implement those techniques, we can definitely help you. We'll be glad to talk to you about those ideas.
Yeah, that's super helpful. I feel like I just had a therapy session. That's how easy therapy is. That's awesome. Thank you. Perfect. So we're coming to our last question here. Were you going to say something, KJ?
No, by all means, go ahead.
Okay. So we're coming to our last question here, and this really speaks to our NOAA family. So what exactly does NOAA Behavioral Health and Wellness do within our agency?
Sure. Loaded question, million things that I'm going to forget half of. So hopefully between me, Valerie, and Andrea, we'll pick them up. One thing that we want to try, that we're aspiring to be, is your one-stop shop information hub for everything that's behavioral health and wellness related. So if you ever have a question about something that's related to behavioral health or wellness, instead of typing it into Google, getting 3.5 million results and trying to figure out how to navigate that, hopefully you can just come to us and we can help you cull results and tell you what information is useful and valuable and what isn't. And in fact, we're actually trying to get all that useful information put in one location for you, which is in our intranet site, our Google site, which of course the URL address for that is too long for me to rattle off here, but we'll have it either on this video or on the landing page where this video is housed. But we'll make sure that you have the intranet link for that site as well. But we're trying to get all of good, useful behavioral health and wellness information in one location for you all. In addition to that, we provide direct services. I don't know if Valerie and Andrea would like to jump in and start talking about some of the services we provide, but I'm happy to. Yeah, go ahead.
And so KJ, thank you for talking about the direct services. So that involves case management, and in that case management, providing consultation and brief. Captain Rathke talked about some therapeutic clinical support. We're just one wherever we're sitting most days, so we can't follow you for long term. But what we do is kind of help you kind of figure out what you need or what your current situation warrants, attention it warrants, and we link you to whatever. We provide support first. Let me say, we don't want anyone suffering alone or by themselves without a direct path or a direction. So we're here to provide you support first of all, and then resources, linkage to whatever service that would be most helpful for you. That's what you can depend on us for.
I agree with what my colleagues have said, and just I think maybe to help illustrate what that might look like, an example could be, so say someone in your office is experiencing panic attacks, where they have panic attacks every day, a couple times a day. Having a panic attack, if you've not ever had one, is so intense that it really doesn't allow you to function during your day. You can't do your job. You can't concentrate. Basically, it would be a huge barrier for someone to feel they're functioning well in their job. So maybe they reach out to one of the three of us and we help them in our short-term support. Maybe we might help them with techniques and tools that we have, get to a point where they're not having panic attacks every day. They're actually getting through whole days without having a panic attack at all. But even with that short-term support, they're still feeling very anxious in general and really don't feel like they're functioning at their highest capacity. They just don't feel great still. So we've done some short-term work to help them function, but a longer-term therapy might really make a big difference in their lives so they can function even better. That would be time we might refer them to treatment, where they might find a therapist that works well with them and can actually work with them on anxiety long term. And case management would be where we check in. How's therapy going? Is it helpful? Do you like your therapist? Are you getting what you need? Et cetera. So that's kind of an example of how we might use those three different versions of levels of service.
And I'm sorry, I just want to jump in here real quick. So when Valerie mentioned case management, I just want to point out that not only we do case management not just for external resources, but also internal resources. There are a lot of resources that are available within NOAA that's also quite useful and valuable to folks. For instance, workplace violence prevention and response might be applicable depending on what stressor you might be experiencing in your work environment. Also, the Office of Human Capital Services offers great resources. In particular, their work-life branch has a suite of work-life services that include, but is not limited to, EAP. And also the Office of Inclusion and Civil Rights, OICR, does great work over there with diversity and inclusion work. So there are occasions when we would refer to those folks internally, but also there's external resources that are too numerous to count. But chief among them are the National Suicide Prevention Lifeline and the Crisis Text Line, which doesn't mean that you have to be experiencing a suicidal situation, but they can certainly handle that, but they can handle anything up to and including a situation like that. And we'll make sure that we have the phone numbers for those. That's the National Suicide Prevention Lifeline and also the Crisis Text Line. We'll have that information either up on this video or on the landing page for the video as well.
And KJ and Andrea, we can't leave out additional education and support as well. If you want more series or us to come talk with your groups about anything related to behavioral health, we're available for mental health first aid, or sometimes it as psychological first aid, group support, grief support. We're here also to come and provide additional education for a gamut of any array of behavioral health services or topics you may be interested in.
Absolutely. So as Valerie's pointing out, if your group is interested in bringing one, two, or all three of us in to speak to you all about any topic related to behavioral health or wellness, we're certainly happy to come in and speak to your group.
Outstanding. And I think we're going to probably flash up on the screen how to contact each one of you and get services. What I'm really hearing from all three of you is that really the three of you are the easy button of behavioral health and wellness. If they're not sure, or they're not even sure if they need services, all they have to do is pick up the phone and call you, email you, and you can help walk them through that. That's what I'm hearing.
Absolutely. Absolutely, sir.
Exactly.
If you take nothing else from this, remember our names and remember our contact information. We can always work out anything else once we're talking with each other. So please remember who we are and how to get a hold of us. And again, our contact information will be made available as well.
Fantastic. Well, I just feel like it is such a privilege to be able to sit and talk with all three of you at the same time here, learn more about behavioral health as a NOAA family. I like to say great science is done by physically and mentally healthy people. And you certainly play a role in helping us to be mentally and physically healthy. And so with that, I also heard, particularly with the services and support that you all offer, that we're not alone. You know, as a NOAA family, we don't have to go it alone. You can help direct us to resources and to ensure that we don't have to go through crisis, whatever the crisis might be in our life, or just difficulties alone. And so I really appreciate that, really value the service that you all bring to this agency. I'm really thankful for our senior leadership's commitment to the health, safety, and well-being of our entire workforce. I think the three of you all really represent senior leadership's commitment to just that, health, safety, and well-being of our entire NOAA family. So I'd just like to say to everyone who's listening in, thank you so much for listening in today. Please remember to take care of yourself while taking care of others. And we look forward to talking to you with you in the future. Thanks for joining us.
Thank you.
Thank you so much.
Thanks.